Hi, my name is Nadine Caron. I'm a member of the Sagamok Anishinaabe First Nation and currently live, work, play, and sometimes sleep on the traditional, ancestral, and unceded territory of the Lheidli T'enneh. I'm the co-director for the University of British Columbia's Centre for Excellence in Indigenous Health. I'm a professor at UBC's Faculty of Medicine, and I'm a surgical oncologist up here in northern British Columbia.
One of the key elements of the project is building up a library of Indigenous DNA, which is aimed at advancing the overall advancement of medicine and in equalizing access to precision medicine for Indigenous populations. How will having that library of Indigenous DNA help in that respect? What are the goals behind that?
One of the goals of the Silent Genomes Project is to actually create an Indigenous background variant library, which basically is involving Indigenous peoples from across the country to share their DNA so that we can look at variants or differences in spelling across many people. And this is taking people that are healthy with no known genetic conditions and basically pulling this information together to create a library of what is normal. What are the variations of normal? What are things that are found at various different levels of frequency within Indigenous populations in Canada? Now, it may sound kind of an odd kind of thing to do, but really there actually are libraries like this that exist for various populations globally, and even a tool that's used by medical geneticists in Canada across the country and genetic counselors and other physicians to help make a diagnosis when something is genetically based. A tool that is often used is called Nomad. What we do then is and what we do, meaning medical geneticists, not me, they take a look and kind of go, okay, here's the spelling of the individual, here's what's normal, and then outcomes, here's what is not seen very frequently in healthy individuals, here's what might be causing the condition, here's where we can focus our time, our energy, and potentially help this person. Unfortunately, Nomad, which is a common tool used and is broken down by many different backgrounds, such as European or Southeast Asian or African, or a long list, there are absolutely no Indigenous identifiers. So if someone comes to this physician and is referred for this, and you're trying to kind of look and see what's normal for this individual. Well, if the child, for example, is European, you can go to the European library to see what's normal. If they're from Southeast Asia, what's normal, and onwards. But if someone's First Nations, Métis, Inuit in Canada, and you say, what's normal in these populations? The answer is, who knows? And all of a sudden, the capacity of the medical system in Canada to be able to assist in this area of medical care is silent. There are no known libraries that exist, not only for Indigenous peoples in Canada, but globally. And so this is an initiative that we're taking on in Canada with the help of Genome Canada and many other funding agencies and partners and stakeholders. But it's also happening in other countries with other Indigenous populations, and we're very fortunate to have international Indigenous partners working with us to fill this space so that we can change the silence into voices, and voices into leadership, and leadership into long-term impact to decrease the inequities in healthcare and health and wellness for Indigenous peoples, both in Canada and beyond.